Today, we are confronting a painful but pressing truth: drug abuse and illicit drug trafficking from our cities to our schools, from the streets to the office. The grip of drug is deepening. Our children, our leaders of tomorrow, are falling victim to addiction. Families are torn apart, dreams cut short, communities living in fear. But how did we get here? What fuels this crisis? And how can we fight back with truth, education, policy, and care? Welcome to another exciting edition of The Mirror with Beauty Benjamin. This is your favorite program. We'll talk about things that happen in the society, from the family that transcend to the society. All of those things are happening in the family. If we correct them, if we tackle them, we can get our society working. Now, the mirror stands to correct. It stands to pick out the details you couldn't see properly. And so when you dress and stand in front of the mirror, you want to check how you are dressed, how you are looking, and that's what the mirror does. It checks you. So this program is all about checking the excesses, trying to balance, trying to make you see the things that are not going well, the things that need to be corrected, the things that need to be done properly before we move into the society, because from the family we get into the society. And so join me this morning as I talk to two beautiful pharmacists that are with me in the studio. They are into the business. I will show you a clip. You get to watch a clip first, then we get into the conversation. But with me now on my left is pharmacist Eberechi Grace Paul Ojimadu. Ebere, you're welcome.
Thank you. Thank you for having me.
You look radiant.
Thank you.
And then on my right, I have here pharmacist Abigail Abisola Elujoba. I hope I got that name well.
Yes, ma'am.
You're welcome.
Thank you very much.
Thank you. First, I want to apologize for coming late. So the program is supposed to be 10 o'clock as usual, but due to some technical issues, we are coming to you late. But I apologize for that. Now we're looking at the impact of drugs and impact of drugs abuse and dangers. Impact of drug abuse, dangers and way forward. Dangers of drug abuse and the way forward. But let me show you the video so you can have an understanding where we're going to. Why I said everything that happens, it comes from the family. They say charity begins at home. If you get a good foundation, you have a proper building. We often hear building collapsing here and there. Now you begin to ask yourself, how was the foundation? How did they mix the cement and the sand? Which one was excess? Which one was not in proper portion and all that? So let's take a look at the video, and then I'm not going to be talking, I'm going to be discussing with these ladies here because they know much about now. How do they get these drugs? What is the need for the drugs? Because all of these drugs that they use are for certain illnesses, certain crises that some people need it. So we cannot excommunicate, we cannot remove these drugs. It has to be in circulation. But how do they get it? So what is the way forward? Let's go. Let's take the video.
Substance is made for a reason. Say no to this particular one. A new highly addictive substance threatening the youth. It is stronger than tramadol, causing irreversible damage to the brain, heart, and organs. Seizures, psychosis, and hallucinations are just the beginning. It can lead to respiratory failure, heart problems, strokes, liver, and kidney damage. That's not all. It can drain your resources and leave you bankrupt. It gives you social isolation, mental health problems, depression, anxiety, suicidal thoughts. It is crime and violence. It is time for us to take a stand. Let's educate ourselves, our families, and our communities about the dangers of this. We must be concerned about the well-being of our youth. To those who are profiting from selling red, I ask, what is the value of a human life? Is it worth the money you're making? Let's call it what it is: wickedness. Let's join forces to protect our youth and our communities, saying no to red. Every substance is made for a reason. Say no to this particular one. A new highly addictive substance threatening the youth. It is stronger than tramadol, causing irreversible damage to the brain, heart, and organs. Seizures, psychosis, and hallucinations are just the beginning. It can lead to respiratory failure, heart problems, strokes, liver, and kidney damage. That's not all. It can drain your resources and leave you bankrupt. It gives you social isolation, mental health problems, depression, anxiety, suicidal thoughts. It is crime and violence. It is time for us to take a stand. Let's educate ourselves, our families, and our communities about the dangers of this. We must be concerned about the well-being of our youth. To those who are profiting from selling red, I ask, what is the value of a human life? Is it worth the money you're making? Let's call it what it is, wickedness. Let's join forces to protect our youth and our communities, saying no to red.
Now you have it. Now, if you're online, you can follow this program on RSCV online. You can also go to our channels. You can watch on Twitter. We have that's X. We have at the Mirror with BB. On Instagram, we have at the Mirror with Beauty Benjamin. On Facebook, we have at the Mirror with Beauty Benjamin. YouTube, the Mirror with Beauty Benjamin. You can also send me a direct message on 070 888-56625. Let's get your questions, your contributions. Let's go. Let me start with you from Eberichi. So what do you think? That's drop name now. It says some call it red, some call it 225.
Yes.
Now, what's your take?
Okay. So first of all, thank you for having me. Thank you for that question. So the video we watched, I mean, it just shows the terrible state, of drug abuse amongst our youths today. So one drug comes on the market and everybody is rushing the drug, chasing a high. Okay, so I'm going to talk about that high. Okay. So most commonly drugs that are abused in Nigeria are antidepressants.
Sorry to cut you. You just finished celebrating the World Drug Day,
Yes.
which was
On the 26th
of June,
Yes.
and the title was. Can you get the title?
Okay, the theme of the World Drug Abuse Day,
Yes.
it was evidence is clear, so invest in prevention.
Okay, evidence is clear. Invest in prevention. Okay,
Yes.
go on.
So evidence is clear. The evidence and how drug abuse has ravaged the society today is clear. We can all see it. It has affected Nigeria's economy. It has affected the state of our youth, how our youths contribute. It has affected a lot of things. So invest in prevention. How do we prevent drug abuse? What is the way forward? Okay, so looking at that clip, we could see youths. Those are the side effects of drug abuse. At that stage, they are gone, so to speak. Most of them have lost consciousness. You can see most of them, they don't even know where they are. So like I was saying before, most commonly abused drugs in Nigeria include antidepressants. Yes, apart from pain relief drugs like tramadol, codeine and the rest, we have antidepressants like this one now, 225.
So what's antidepressant?
Okay, an antidepressant is a drug that is prescribed to treat a condition, a mental condition.
Okay.
Yes,
okay.
known as depression.
Okay.
Yes. So depression is characterized by withdrawal, mood swings, somebody always losing interest with what used to give them joy before. Yes, the person no longer wants to participate. The person no longer wants to do things like other people. The person is always indoors, thinking about having sad thoughts. That's depression. Yes, suicidal thoughts. Yes, so that's depression. So when you go to the doctor and you're diagnosed of depression, you are prescribed antidepressants. Okay, so an example is this 225 now. It has another name, should be venlafaxine, So so what antidepressants do? Okay, what antidepressants do is to go to the brain. Okay, drugs, all drugs alter the brain's activity.
Okay.
They alter brain's activity now, and many of them alter behavior too.
You say all drugs?
Yes, all drugs. All drugs go to the brain.
Okay.
Before they go to the other organs of the body. Okay, so antidepressants, what they do is to I will call it hack into the brain's reward system. Okay, so when we as human beings do participate in activities that make us feel good, you know, you have a task on your to-do list and you finally achieve it and then you tick it off, you feel good.
Yeah.
So what is released in your brain? You have dopamine. That's the feel good hormone.
Okay.
Yes, so it's a hormone, it's a neurotransmitter.
Dopamine. Okay.
Dopamine. So another happy hormone is serotonin.
Okay.
You know, yes, you have serotonin, you see your friends, you participate in pleasurable activities. You know, these hormones flood your system.
Okay.
Yes, at a particular amount.
Okay.
Okay, yes. So what these antidepressants do is they notice that, of course, there's a lack of dopamine. I mean, this person is sad, so dopamine levels are low. So these antidepressants, what they go into the brain and they mimic, you know, the action of these pleasurable activities. So they cause a flood of dopamine in the system.
Are they working like spirits? You know, it's like the way I thought working like spirits. I'm almost like I'm thinking, are they spirits?
No, they are not spirits.
Okay.
They are not spirits. So yes, drugs are chemicals that affect the brain.
Certainly.
Yes, they affect the brain, they affect the body, you know, they affect behavior, you know. So they are not spirits, you know. They go into the circulation, and there are things called receptors. So the body has receptors. There are receptors that, you know, they are responsible for, you know, your glucose level. You eat food, and what's responsible for that glucose entering the blood? What's responsible for it entering the cells, and then you have energy to do what you're supposed to do? Those are receptors. Okay, so receptors. Okay, I'm speaking a lot of
Don't worry.
English here. So I was talking about antidepressants. Okay, so what they do is to cause a release of dopamine, feel-good hormones, dopamine, serotonin, okay, in the blood. Okay, so that person is no longer depressed. That person experiences
And feels joy.
yes,
Expresses
yes,
that
yes,
is excited.
yes. So a high, we'll call that a high.
Okay.
Yes. So what we see in these cases of drug abuse, okay, of drugs like this 225 now, antidepressants, is that people have, let's say your friend was prescribed this drug, and of course it's treating your friend's depression. You're seeing that your friend is no longer depressed, you know, and your friend is like, oh, you know, I'm taking a drug that is making me feel good. You too should try it. And then you go and try that
Without prescription.
without prescription. So that is drug abuse. You know, you go and try that drug to feel good. Okay, you try that drug and you're no longer taking it according to dose. Of course, you don't even know the dose. So you feel good. Let's say you feel good at level number 1. Okay, and next time you want to feel good like that, and you're like, no, you want to feel better than this. And
Level number 2,
level
number 3.
2, yes. At a point, you know, you continue chasing that high. That is number 1. So the dopamine that is released in the body is at abnormal levels.
Okay.
Yes.
So now, this program is all about what happened in the family that transcends to the society. These people are coming from a home. Do you think, like from what she's explained, do you think that the family or the economic or the family status or the economic status has any part to play in people getting into this kind of drugs?
Okay, with respect to the fact that if a patient is being diagnosed of a particular condition, a particular mental condition, and this person takes it, and then you tell your friend about it, oh guy, I've been taking this thing and it worked for me. So the friend will be like, okay, I would like to take it. And then this friend that has this mental condition will want to share, will be willing to share, will be willing to share with other friends. Oh, this is it, oh, you can take this and all. So the person takes it. When the person takes it and feels good, there's a kind of, I think in the pharmaceutical world, there's a kind of relationship you build. There's a kind of relationship you build with your healthcare practitioner. That they'll be like, okay, this person has been coming for this particular medication. That it gets to a point that if they ask for your prescription, they will be like, okay, just bring it like that, you know me and all. So I think the healthcare professionals have a role in playing.
That is where you guys come
That's
in.
where we come in.
That's where you come in.
Exactly.
Mm.
So when people bring their prescriptions, you don't just dispense without validity. You understand? That means if you're supposed to take a medication for 1 month, what they do most times, medical doctors do, they prescribe a particular medication, they tell you the duration and the frequency, so it shouldn't exceed the duration in which you were given. If they say you should take this particular medication for 1 month, then you come back and then they run some checkup on you to know if you are better, if there should be an adjustment, if there should be addition to whatsoever medications you're on. So when a prescription is being brought to you as a pharmacist, you're going to check that prescription, you understand? So if this patient, if you bring for instance, today is 4th of July.
Yes.
So if you bring a prescription to me that the validity has already expired, maybe since February, and you're bringing it to me 4th of July, I won't dispense such medication to you.
You won't dispense.
Exactly.
But we should not dispense, supposing you're not together. Now, I'm looking at it this way. I come to your place. You know me. I buy drugs all the time. Now, I've been bringing prescription. Then I come back. I don't have the prescription with me today. But you know me. And I'm like, but you know me now. This way I buy drugs from now. What you give me? Will you sell?
Okay.
Because that's what we have.
Exactly.
That's I said. That's I say. You people are in the center of it. Now, because you're familiar with me, are you going to check the validity? Because I'm not coming with a prescription, but let me take for instance, maybe a child who is a sickler, and then it takes normal hydroxy. I'll be buying it from you, from your place, from your hospital. So when I come, I want to buy it. You're not asking me what am I buying, because you know I have a condition that I'm taking it. So that same is applicable to these other drugs. Because I'm checking it now. If we can check it from the counter now, I said about the family, we'll come back to that. But if we can check it from the counter, if we can cut it, let's say we have like 20 pharmacy shop in Elelemo, and 19 vividly refuse to sell without a prescription. Don't you think we'll be making a headway?
Yes.
They will. But in the aspect of friendship and business, it's actually from practice, it's actually a hard nut to crack. But if
Not to crack in what?
in the sense that you feel, okay, this person is my friend, this person is my customer, this person has been my patient for a very long time.
And money is involved.
Exactly, and money is involved. So instead of looking at the money and the friendship, just look at the person's health, the person's life.
That is reality, how it ought to be.
Exactly. So if in Elena 20 premises agree not to sell a medication that is not supposed to be sold, then I think we'll be doing a good job. Not I think, I'm very certain we'll be doing a good job in the life of this addicts.
Yes, but much, let me just add to what she said. Yes, much more than that. We have a register input. You come and you've been coming. You write the drugs, we record the drugs that you've been on, according to the dose that you've been taking that drug, like according to the dose prescribed for you. Yes. So if we know that, okay, you've been prescribed for, you're saying hydroxy, for 30 days, we know that, okay, you are due for a refill in another 30 days. Okay. So when you come without a prescription and you have a very, very, very tangible reason, and you're due for a refill, sometimes you overlook that. But that's a one-off, But I think the problem comes when people get these drugs from people that are not licensed. to sell this drug. So that's why that drug abuse day was International Day Against Drug Abuse, and illegal, illicit
Illicit
drug trafficking. So there are people that's their business. That's the way they make.
So
their
why
money.
do we have, is that a law, is that a body responsible for
Yes.
curbing those unlicensed people?
We have
from selling?
NDLEA, National Drug Law Enforcement Agency.
Yeah.
Yes, that's their work. That's their role. So they have been able to crack down on a few, will I call it factories now, industries, selling these drugs, making these drugs, manufacturing these drugs.
Okay.
On a low, yes.
So now let's come back to the question I want to ask again. Family.
Okay. So the family, how does the family
Play a role.
yes, what role does the family play? Okay. Interestingly, studies have shown that someone has, or a child or a young adult has the risk of becoming addicted to a drug later in life if one of the parents, or somebody in their family was addicted to that drug. So it is a thing in the gene. Okay, so it's passed down from, this thing about what parents don't resolve, it's still passed down to the children. Yes.
So you guys believe it in medicine?
Yes, studies
Because
have
I
shown
had a
that-
doctor here who said people don't believe in even the miracles we talk about in Christianity.
Yes.
They say medicine does not believe in miracles. So do you believe that hereditary is something could carry over from?
Definitely.
Oh, wow.
Okay, for instance now, even apart from drug abuse, cancer, a woman, studies have shown that sometimes, like I've seen a case of a woman that had cancer, and she found out that her mother had cancer, her grandmother had cancer, and before she had the cancer, she had ovarian cancer. Before she had a cancer, because they had been having breast cancer, she went to remove her breast, thinking that it had passed. But then there's a component of the gene, and she had ovarian cancer. So that's why when you go to the doctor, they ask you for your family history.
Yeah.
They want to know. Yes, but even apart from the family history, it's just a risk factor. It does not mean that this person for sure would have or would become addicted to a drug later in life. Yes, even apart from the gene, how parents treat their children, so there's a way you treat your children. They can't open up to you.
Okay.
They can't meet you for advice, and that's where peer pressure comes into play. So the people they go to meet for advice, the people that they spend their time with are people that are abusing drugs and even addicted to these drugs.
Okay.
And they're around these people all day, So another example too is parents that physically and emotionally abuse their children.
Exactly.
Yes,
So
so
they will be like, this person is better than this person.
Yes.
So they start comparing.
yes.
Am I better than this person? Why is this person better than me? And all of that. So when that comes to play in and it becomes habitual, it affects the way they
Outside,
reason.
yeah.
And then they will go to where they see love on the streets. If you see most of these people, they actually like themselves. There was a day I went to get something. This man bought cigarettes. He wanted to buy 5 or so, and then the man added 2 extra. Oga, because you be my friend, I want you to feel good too. So he added, and I was like, really? So they go where
Like minds.
exactly
Exactly.
they feel that love, and anything that is being offered to them to feel good, to feel better.
Don't you think we should take this campaign to the schools also?
Yes.
Because children from home, they go to school. But to the schools, even in the churches, we should talk about it. Now, I haven't looked at it now because I'm looking at time. People like behind the camera are talking about some of these guys who do labor job. Now, we're just discussing it. What a machine would do in a period, a time frame, these guys can do it with the aid of these drugs. Is it that they are trying to measure the strength or are trying to cash out more? What is the motivating factor that make them now, I want to move this thing from here I did a crane. Oh, the crane say I'm coming. I said, oh, we can knit it, oh, we can do it. Oh, is it the money that is motivating them, or they to show strength that we can? I feel do it. We don't need that machine. What's the motivating factor?
Okay, so this let me just rephrase what you said. Why do people abuse drugs to perform, right?
Yes.
To perform both
Because
at work.
in the highness, now this drug aid them, gives them extra strength, like you said, highness. When you high, maybe that mountain or that fence, I feel if you climb or jump. But in highness level, I'm operating on another level.
Yes.
I just put pa, I skate through. So what motivates them into it?
Okay, I would like to say something.
Okay,
It's a two-way thing.
okay.
I'm the one selling the drug. I want the money, in as much as health is involved. You're the one coming to, oh, I want to get this particular medication, so I'm going to work better or work as though I'm a machine. I don't want to feel that pain when I'm working.
Yeah.
I think the class of people that abuse this stuff is all these wrestlers. You understand? Most of them abuse this drug called amphetamine. So it makes them feel high. When they're on that stage, you see them doing things that on a normal ground, they wouldn't do it without those medications.
But let me take you back home here. If you go to sites, go to market, go to places, you see these young guys who can lift a bag of beans, like something that 3-4 persons should carry. One person will lift it and go as many as 10 times. They're not wrestlers.
Okay. So in that case, in as much as they want the money, the time that they will take in lifting maybe 20 blocks, if they use such medication, they can use it in carrying 40 blocks. And it may be based on how you work that you'll be paid.
Yeah.
So they are in for the money, and on the other side, they don't want to feel the pain. They want to be very active.
And they're unconscious of the dangers this thing is causing to their system.
Some of them don't even care. Yes, they don't even care. They'll be like, provided say I get the money, I'm good to go. So that's just
pressure
it.
to perform.
Exactly.
That pressure to perform. It's just like even students abusing caffeine to be able to stay awake all night, to be able to stay awake all day.
So
prepare for
can you
exams
abuse
and all.
caffeine?
Yes, you can abuse caffeine.
Oh wow.
Yes, you can abuse the caffeine.
Maybe I must have abused caffeine those days back in the days. You understand?
Yes.
Yeah.
So, in fact, caffeine is one of the most commonly abused drugs. After that should be alcohol. Yes. So, so that pressure to perform is a cause of drug abuse. It's just like peer pressure. So there is a reason why they are doing that. There's a reason why they are doing that. They want to meet an expectation. Yes.
So don't you think in that category you should put paracetamol, Panadol there?
Okay. Yes.
Because at the slightest pronouncement of my head aches, the person says, I take paracetamol, I take Panadol now.
Okay.
So
in that case, when people come to complain about body ache, backache, this place paining them, that place paining them, at every slightest discomfort, they want to take medication. But sometimes, or most times, it's just lifestyle modification. Most times, you just need rest for that headache. That waist pain, you just need someone to massage, a supportive therapy, someone to massage
and massage is costly, you get that?
You can
but
get
50, 100 naira, 100 naira Panadol will solve the problem.
Yes.
You see why we are in this situation? Yeah, go on.
We should look at the long term of all these stuff. You
Yeah.
understand? There was a particular lab test I saw. So when I saw it, I was like, okay, this was the reason. So when we got to interact with the woman, she was like, she abuses painkiller, and now what her liver is damaged. There's enlargement of the liver. So some people just feel that drugs are candies. Once you have just any slight, oh, give me this, give me antibiotics, any slight pain, you want it. Probably you shaved your pubic area, and then you're like, Oga, I saw so and so in my pubic area and I want antibiotics for it. And most of them don't even take the proper.
Cutting and mixing.
Exactly. They say cut this one, mix, cut
Okay.
this one, mix.
Okay, now because of time, let's look at before we go to way forward. Those who are on lifetime illnesses that they take these drugs daily, are they also abusing it? They are on, that is a lifetime or terminal sicknesses
Okay.
that they need to take certain drugs on daily basis. Are they abusing it?
Okay.
What are the dangers?
If they take it according to the doctor's prescription, they are
Exactly.
not abusing it.
Okay.
They are not abusing it. But then there is a risk of what we call dependence on the drug. They could, at a point, they could become dependent on that drug. When they don't take that drug, they experience withdrawal symptoms. You know, they shake and all of that. And then there's also a risk of tolerance. Initially, let's say 50 milligram of that drug used to work for them. At a point, 50 milligram is no longer working. They need to take 100 milligram. So now they are beginning to misuse the drug. So that's last week we talked about drug misuse. You know, taking drugs that are prescribed, but not how they are prescribed.
Okay.
Yes. So when they misuse that drug, you know, that's misusing the drug now, you know, leads to that all of those tolerance. You know, that's 50 milligram no longer works for them. You need to keep taking a higher dose and a higher dose and a higher dose. Yes. So at that point, we won't say they are abusing the drugs. You know, they are abusing the drugs, but they are misusing the
They're
drugs.
misusing the drugs.
Yes.
Okay. So now, like our topic say, now dangers of drugs and the way forward. What is the way forward?
Okay, like I said earlier, the healthcare professionals, they have a role in playing
Excuse me. Yeah.
with respect to drug misuse, drug abuse. When a patient comes to you, irrespective of the fact that you want to have the money, there should be professionalism in it. So you tell them, this drug is going to help you feel good now, but on the long run, it's going to affect you. So we should stand our ground. I know it's very hard because, I mean, we are working, in as much as we are working for the passion, we also need the money.
Of course.
So we should stand our ground. I'm not going to dispense this medication to you. Some of them will go violent. Yes, they will abuse you. You'll be like, I'm never going to come back here again. I'm never going to do this. I'm never going to do that. But please, get your prescription. Then come back.
So what is the role of the government in moving forward?
Okay. So I want to add to that. We took an oath. We took an oath, yes, not to illegally like dispense these drugs and all of that. So we should remember our oath. That's true. And then the patient too. You know, the common man, you go to the pharmacy, you go to the hospital, you're giving a drug, and nobody explains how to take these drugs.
You know, let me
Ask.
when you say oath, now I'm just thinking in my head, if the oath was like when you go to Amadioha shrine, and then they carry one fowl and then they say
Not
this will happen
died.
to you. Do you understand? Because a lot of people have defaulted. Now go on.
Okay. So there's this patient counseling. You know, the healthcare practitioner explain to your patient what this drug is for. What are the risks? You know, there is a possibility. There's a risk for tolerance. There's a risk for, you know, dependence on this drug. And you as the patient, you go to a pharmacy, you go to the hospital, ask questions. Let them be the ones tired of it. But it's your right to ask questions.
Okay.
It's your right to ask questions. So to even parents, you know, you have teenagers, you have young adults around you. Make sure they are not idle.
Adults also take these drugs, so
Yes, young adults. Even
Older adults.
Yes, older adults. Yes. So because bad habits could start from any time, any point in your life. But make sure these your young adults, your teenagers are not idle. You know, they say the idle man is the devil's workshop. You know, and most people that take drugs, they take these drugs when they have something missing. You know, or you see some people resort to taking drugs when they are depressed, like we've spoken about. Some people taking drugs when they lost someone, they are grieving someone. You know, some people taking drugs because they have nothing to do and they've seen people, you know, it's presented to them. So that's where peer pressure comes in. But first of all, make sure that the youths around you are engaged, they are busy.
okay.
You know, and then there's even stress management. Okay, so you're working or whatever is happening around you and you're stressed. There are better ways to cope with stress than resorting to drugs.
So do we need any help from government
Okay,
or organizations, groups?
okay. Well, I think what government can do is to help with funding. Okay, there are a lot of agencies that what they do is advocacy. They go around, they go to schools, they go to different places. You know, they tell people about this drug abuse and all, but many of them are underfunded. Okay, so I think government can help in funding.
Okay.
Government can help in funding both for the NDLEA and the rest to be able to apprehend this illegal drug trafficking.
Okay, Abisola, your final word, yes.
Okay, the family too has a role to play.
Okay.
If you notice your child is used to doing this particular thing, has interest in, let's say, football, has interest in any other thing aside from football, you should watch them too. We talked about withdrawal. You understand? We talked about withdrawal. So you should be very careful.
Vigilant, careful.
Very, very careful. Watch what your child is usually interested in. Most of them don't even go to schools when they send them to school. So as a parent, you should be very vigilant with respect to your child. So as a parent, you should be very vigilant with respect to your child. And also, sometimes when you ask your children questions like, are you sure you are not on drugs also? They'll tend to lie.
Of course.
They'll tend to lie. So they are specialists. They actually carry out tests to know if this patient or this particular child is on any substance or not. Okay. So as a parent, you should be interested, you should be very, very vigilant with respect to your child's mental health. Okay. So whatsoever therapy that is needed, maybe supportive therapy, things to make them ease stress aside from the medications they are actually abusing. So as a family, we have a role to play before you push them out to the government.
Okay, thank you so much. That's how far we can take on this edition today. I hope you have learned and you've heard something. If you're a parent, if you're a government, if you're a group, whatever you are, let us learn. Let us be, that job you're doing, be conscious, think of the person. You're dispensing these drugs, think of, be conscious about the person. As a mother, as a father, as a guide or whatever, be alert. Look at your children, look at your neighbors, look at whoever is under your care to take care, because these organs, when they are damaged, they are irreplaceable. That person is gone. Let us try. Government, we need your help. We need assistance to fund the NLDA, let them do the job properly. And agencies that want to advocate, let's also assist them. Let's make a better society. Now you can follow this program again on the X at the Mirror with BB, and Instagram the Mirror with Beauty Benjamin, Facebook and the Mirror with Beauty Benjamin, and YouTube the Mirror with Beauty Benjamin. Thank you for today. I'm happy to have you. Thank you, Beauty. Thank you, Abisola.
Thank you very much.
I hope that some other time we'll have another time to do this. Now we will have more. Let's keep talking about it. You can't exhaust it in one day. Thank you. I'm Beauty Benjamin. Have a lovely weekend.